Viewpoints on the talk station FM 107 AM 1240, which we do not like to do here, is we end up with a conversation in the studio, and we're going to get to that, rehash that conversation, Asa, since you started the question with Ray. But before I even go to that, I want to give Mom one more opportunity, who is with us. She's been with us several times now in Jacksonville, her experience on behalf of her son. And with that, Mom, thanks for being with us, as always. Appreciate this.
All right, thank you.
Let's go back to the initiation, your son's situation.
Okay.
How did it come about?
It was a back injury from football. He was prescribed pain meds, also physical therapy, and I did not know that, well, when the prescriptions were no longer available, he was obtaining pills anywhere he could get them illegally. And he did come to me maybe 6 months after that and realized he did have an addiction problem. And that night I had him at an ER facility. He was evaluated by the ER doctor, and an outside crisis counselor came in. They told him he did not have a problem.
And the reason why they told him he didn't have a problem was because he admitted he had a problem?
I guess. I don't know. I mean, never been able to get answers on it, but, my son just knew he had a problem. I always, when I'm dealing with issues with my son, like I'm sitting here today, and I'm thinking, if he would have got the help then, where would we be today with our son? And if I can just jump ahead, maybe a few months later, someone had suggested an IVC order, which
involuntary
commitment order.
Okay.
I hated to do that to my child, but that was an option that was given to me to try to get him help behind the scenes. Well, that did not work. And one thing I can say is to make sure that when your child is admitted somewhere, that there is clear communication between you and the caregiver, because unfortunately what I was communicating to this outside psychiatrist that was contracted to the hospital was not treating my son for addiction. He did a 15-minute Skype interview with my son and said he had bipolar. So that's what my son was being treated with. I stayed in constant communication, with the hospital, with this outside doctor's office. The plan was for my son, when he was going to be discharged, he would find a place for him to go for treatment. One day I went to visit my son at the hospital. The nurse's desk, one of the nurses told me he was being discharged, which shocked me. I questioned why he was being discharged. This psychiatrist had made the determination that I was never available for communication to discuss the care for my son. And, of course, that set me in a spin of questions, anger. Social worker got involved. And I kept on saying this, that's not true. You all know I've been here. I've been communicating. My phone records could show that I didn't have calls coming from him, but I had calls going to his office, to the hospital. Had no choice. Fought the discharge. My son was discharged. He was discharged with 3 prescriptions. I remember one being Ambien. I questioned Ambien. Again, I was told, well, most patients that have addiction also have bipolar. I was told that. I refused to fill those prescriptions. I was not happy with how things went, and I did meet with the board of directors at the hospital. I guess my story hit a few nerves maybe because the psychiatrist no longer is contracted through their hospital. However, that did not get my son any help.
Where is your son in this regard? You were seeking...
He is in a safe place right now.
Okay.
He has been, as of today, I got some good news. He's been pre-approved to go to a 14-month treatment center, which he is on board with.
Okay.
He is definitely on board with. So I just felt I needed to share that story because please, make sure
just because the professionals are saying something, you should not ask them questions, or for that matter, seek second opinions.
Yeah.
Okay.
Or look at your child's records.
Okay.
See what's being prescribed. Actually, you have that right as a parent to be able to look at your child's records every day to see what they are being given and what the actual treatment is.
Ray, let's go to you on this one. And Asa, thank you very much for continuing to make this program happen. Asa Buck, of course, Sheriff of Carter County, and I might add, former co-chairman of the Governor's Task Force on Substance Abuse and Addiction. Yep. But still on that board, as I understand.
Still on that task force.
Task force. We have Ray Connor join us. He's the executive director. Am I proper title on that?
Well, program supervisor.
Program supervisor.
Executive director sounds cooler.
Port Human Services. Tell us about this organization.
Port Human Services is a rather large agency. We have offices primarily located in eastern North Carolina. We go from Wilmington all the way up to Elizabeth City, Nags Head, in that area. Greenville, New Bern, and the newest clinic that's just has been opened is the one here in Morehead City. We opened on February the 15th of this year, and I think I can quite literally and truthfully say we've hit the ground running. We felt like coming in and beginning this clinic that we would fill up quickly with our numbers. Port serves a dual population of mental health needs as well as substance abuse. A lot of times we find that there is that comorbidity where there is a mental health illness as well as a substance abuse issue. That's not always the case, but I would say in a majority of those cases you do see that.
We were talking, as a matter of fact, with Dr. Patcar, and he brought up the relationship with mental health and substance abuse, and particularly he said it's a form of coping. It's a coping mechanism. Yeah. Not everybody has that situation, but they get, as we've had situations explained to us in the past, people who have encountered drugs and unintentionally become addicted to them. I think everybody is unintentionally addicted, but as a result of prescription usage, case in point, mom, son. But the mental health aspect of that, do you, when you're talking to your addicts, do you carry on a mental health survey, if you will?
Well, the process for getting into treatment with Port is pretty simple and straightforward. We schedule the patient for an assessment, and we call that a comprehensive clinical assessment, diagnostic assessment. It has several different titles. But the idea behind that is just get a psychosocial history of the patient, find out what their family history looks like, finds out what their current presentation is, what exactly is bothering them at this point, what brings them into treatment. Obviously, a lot of people don't come to treatment, so we're anxious to find out why now. Why are you coming now? And so out of that, all of that information that's gathered, we formulate diagnoses that are based on the DSM-5. And out of that diagnosis, if there's a opioid use disorder, then what we do next, if they're interested in pursuing that treatment protocol, then we staff them with our psychiatrist who's on staff, and we have a treatment team where we come together and we look at this person to see if they're appropriate for services. If we think that buprenorphine or the SAOP program that we offer is a good fit for that patient.
Okay, well, you're using acronyms, I do believe.
Yeah, SAOP is Substance Abuse Intensive Outpatient.
Okay.
And it's referred to as an enhanced service as far as state terms are concerned, and it offers the patient 3 3-hour groups per week. That's the expectation. They're expected to attend 30 groups, and over that course of time, we help the patient identify what are your triggers. How do we cope with those triggers? I often tell folks, addiction is seen in either wanting to raise or to elevate a good feeling, or else is used to lower an unpleasant feeling. And so we try to identify what are your triggers, and then we try to implement what are some good coping skills that you can use instead of going to that drug of choice. How can we help you develop the tools to deal with that unpleasant emotion or that unpleasant set of circumstances to help you get through that? Then we focus on prevention and how to help that person thrive and succeed in their life.
Dr. Patcar, as a matter of fact, mentioned this in many regards. It's a crutch for coping. You've got folks that are on drugs, addicted, and alcohol too is a drug, by the way. Just make comment on that.
Sure.
And they are seeing a psychiatrist. Sometimes I would think, as just a civilian here, that these addictions create mental problems, psychological problems, do they not?
They can, and again, how I've often heard it described is sort of like which comes first, the chicken or the egg. Certainly, an addiction problem can create or exacerbate a mental health concern, and vice versa. So, I don't know that we spend a lot of time on trying to parse that out, but we try to look at the person holistically and say, how can we help? Because we're going to address both the substance use problem as well as the mental health concern.
I just wanted to add that if there would have been an opportunity for a correct evaluation for a mental diagnosis for my son, I would have been on board with that. What was disturbing is that his medical records did validate that the bipolar diagnosis was made within 15 minutes.
Oh, well, right.
And so, and that's where, it was just...
We'll not get into that. I have a challenge from just the concept
Okay.
of the Skype,
right.
The Skype interview 15
Yes.
minutes ago.
Yeah.
Okay. Ray, you and Asa were talking off air, and I want to get back to the conversation. The patient list that you're experiencing, where are they coming from? But then I want to talk to you about how the recovery works. What's the program? What are the pitfalls for the program? Because one of the issues here, and Mom, you're working on this, is we've got to find solutions. Now, you're finding a solution for your son.
Yes.
But to go back to something that we brought up last week, Asa, 604% increase in newborn addictions.
Right.
From, looking at this dates again.
2004 to 2013.
2004, 9 years.
Yeah.
Newborns.
So what is that? What kind of groundwork is that laying
exactly
down the road when these kids grow up
to
and
become
start beginning
to
have problems?
And might they be
predisposed?
Predisposed,
Yep.
Exactly. Asa, you asked the question earlier. We've got Asa Buck, Sheriff of Carter County, also a member of the Governor's Task Force on substance abuse and
mental health and substance abuse.
Mental health and substance abuse. All right. So I keep botching it. We have Ray Connor, who's the program director of Port Human Services, and we have Mom from Jacksonville, who earlier shared her experience on behalf of her son, who you say is now headed, if all goes well, to a 14-month program?
Yes, be out of state. And I will say that our pastor helped work that out too. So, reach out to your pastor.
Right.
They have connections too. So
again, we're looking at the immediate solution, but there's a long-term problem here.
Yes.
We talked about this a few moments ago. 604% increase in the number of newborn babies born with addictions. 604%. This really is, now that I'm thinking about it, Asa, epidemic.
It is an epidemic and has been for some time.
And guess who gets to pay for it?
Us.
Yep. And in the process, also family members. That's not to demean that. I just want to say, okay, Ray, let's talk about this Port Human Services. We were chatting a moment ago about the frustration that Mom had with the emergency room. And I said, emergency rooms, hospitals are set up to handle physical ailments primarily. Now they're facing a growing number of patients that are coming in with substance abuse problems and possibly associated with it mental health issues. Asa, you asked him where were the patients coming from? Where are your patients coming from at Port Human Services?
They're coming from everywhere. That's not an exaggeration. They come from all walks of life.
You opened up the office in February in Carteret County. Did you have an anticipated number of patients or clients?
Well, we didn't have an exact number, but we knew that there was certainly. I have been in this Carteret County area for 20 years now, and I think in my entire 20 years, I would say that we have been an underserved area, and so the resources have been limited. I think there is some headway being made and addressing some of those needs, but we felt like that our caseload would quickly accelerate, which it has. We offer the SAOP, the Substance Abuse Intensive Outpatient Program. That's offered 5 days a week and Monday nights, along with other substance abuse program. That's more of a step down. After the patient completes the SAOP piece of the puzzle, then they're stepped down to that 1 hour group that meets 2 to 3 times a week. And our numbers have been steadily climbing since we opened the doors in February.
Where are your patients coming from? Or are they patients or clients? What's the right description?
Well, we use the term patient because we look at we don't just see the person as a statistic and substance abuse or as mental health. We see them as a person.
Okay.
And so we are addressing or attempting to address a variety of needs as our patients present to us.
Well, they're coming from what sources?
As far as referrals, they're coming from Sheriff Asa's department, probation officers, the Carteret County Health Department, public school system, Department of Social Services, and just individuals. We have families that are doing their homework, doing their research, which is a good thing, because when the person is in the throes of that addiction, they're not really thinking about recovery as much as they are how to get that next fix and how to keep from being dope sick in the morning. And so that's what we're seeing.
Ray, can I ask you a question? And I asked this question, I believe, last week to Dr. Pat Carr. We don't have an inpatient facility here in Carteret County.
Wish we did.
But we do have various resources for outpatient, and you mentioned intensive outpatient treatment. In your opinion and your experience, is outpatient treatment effective for those who have substance abuse issues?
I think it can be, because one of the things that we often do is prescribe the other medical part of that, which is the buprenorphine or the Suboxone or those types of drugs that are used to help lessen the withdrawal and the cravings for the opioids. And so when that works in tandem, and of course, then you run into other issues like diversion.
Right.
And you're more aware
What
of
is
that.
diversion?
Diversion is when the patient is basically not using the medication as prescribed. It can be sold, it can be traded, it can be given away.
Abused.
And so what we try to put into place are some strategies to help lessen that. And I don't know that you can ever really stop that because it is a controlled substance and it's going to be very hard to stop that. But we do try to put measures into place that can help eliminate some of that diversionary activity. We make diversion calls to patients and say, we want you to bring in your medication so we can do a med count. We insist that the patient keeps their medications in the container in which they picked it up from the pharmacy in. And again, it's not foolproof, but I think I refer to our program as fair but firm.
Right.
And that we're willing to work with the patient, but we do have certain expectations that we expect that patient to adhere to. And if need be, we sometimes have to make the painful decision to discharge patients if they're just not being compliant.
And the reason I asked the question about outpatient is, and I hear this a lot, I think a lot of times people have an expectation of what drug treatment is. I think that people just think that, if someone's going to go get drug treatment, they have to go off to a 30, 60, 90-day program, and that is the only way that person can be successful. Right. And that's just not the case. And a certain percentage of people go off of that intensive inpatient treatment, but a lot of people can be successful with their recovery if they would at least attempt the outpatient treatment. But here again, it's in drug addiction, drug recovery. I mean, it's hard to do. If it was easy to do, everybody would do it, and we wouldn't be sitting here having this conversation.
Absolutely.
But that's what I always want to reinforce every time we get the opportunity.
Absolutely.
Is you have to go and you have to try, and if you fall off the wagon, you got to get back on the wagon and keep trying.
Right.
Don Mrdanovich said that we treat failed addicts as failures.
Right.
Whereas he said failed heart patients, we just treat the heart patient and we keep treating them. Yeah. And the other one, and we had a caller from down east a couple of weeks back who made comment of fact that because he was, Mom, I don't know if you remember this, but he said that he was on Suboxone or one of the drugs, but he was also getting counseling, and he said it was a partnership between the counselor, his medical provider, and himself.
And that's one of the things that
10 years.
That's one of the things that we require, because even with mental health, I don't like the idea of just throwing a medication at my depression or at my bipolar disorder. I've often asked people, so what you want is a medication just to help you feel better in your dysfunctional lifestyle.
Right.
So we really emphasize the dual treatment of not only the medication management, but also the piece that I think is vitally important. That is good therapy that's done by trained clinicians.
I want to get to that in a moment, but we've got a caller standing by. I want to go to John down east. And with that, John, good afternoon. Thanks for joining us.
Thank you, Lockwood. Thank you, Sheriff Buck. And mom from Jacksonville, and I did not catch the other person's name.
Ray Connor. Ray Connor.
And what does he do?
He is the program director for Port Human Services.
Okay, is that like a mental health psychiatrist type thing?
Well,
yes,
go ahead.
we do treat mental health.
Yeah, go ahead, John.
Well, I don't want to be crossroads, and mom from Jacksonville. I'm not directing this at you. Your situation is probably different, and it probably happens all too often.
Right.
But I have to ask the question, because what I'm hearing from everybody except mom from Jacksonville is we're treating symptoms, and nobody is talking about why we get to the point where kids, and actually lots of other people, get on drugs to begin with. I'm sure Sheriff Buck has a lot of thought processes on that.
Right.
But seriously, I don't see. In Lockwood, I'm going back to a couple of programs before where you had a psychiatrist. It's been about a year and a half ago.
Right.
Psychiatrist, and I don't know what the term was that she had. Some consequences, something consequences when you're faced with a situation that is against your upbringing or what you.
Your coping skills, John. Let me cut you short on that but stay with us. We talked to Dr. Pat Carr last week, and one of the questions I asked is there an increase in the inability for folks to handle the environment in which they're working as coping skills, and he said, Asa, that. I asked him specifically about the impact of digital communications, teenagers, what kind of stress they're facing this day and age, and he said that they're going to be doing studies on that, right?
Yeah, I believe he said that the studies were underway on the long-term effects of video games and social media and the way that people communicate today versus the way we used to communicate 10 or 15 years ago.
I've got to go to a break, but it's an interesting thought you brought up, and I'm looking at a story, oddly enough, from an organization I don't like, Huffington Post. I'll share that with you here in just a moment. John, thanks for the call. We're going to continue this conversation.
We sit there with kids nowadays, and they really get a lot of things that they don't learn the coping skills because they haven't been challenged when they're young.
Well,
and now they're giving in to anything that comes their way.
That's part of my conversation with Dr. Pat Carr. John, thanks very much for the call. I appreciate that. This is a growing problem, and I'm just going to one more time reiterate what Asa wanted to correct, a USA Today story which said that from 1999 to 2013 there was a 300% increase in the number of newborns with drug addiction. He said that's wrong, that's got to be wrong, and he brought in the statistics for North Carolina alone. Of course, this is the only state in the entire, we only got, two states in the union?
This is the most important one to us.
No question about it.
Absolutely.
604% over a 9-year period. That's from 2009 to 2013. That's newborns with drug addiction. You want to talk about the ultimate innocent?
Absolutely.
And yet, as they are delivered to the hospital, they are addicted. Okay, my question, Ray, are we setting our youth up for a fall?
Yes, YES, yes. And
Wow.
I kind of come at this with a little unique situation because not only do I address these things clinically, but I'm also a pastor.
Okay.
And I believe that one of the things that we are missing in our culture is the continued secularization of our culture, that we have departed from our Judeo-Christian roots.
Okay.
We have lost some of what it means to be, and this is not true in every case, so please, this is not a blanket statement by any stretch, but we see it all too often. We see an entitlement mindset where whether it's talking about material goods, college tuition, or instant gratification through use of a needle or a pill that we swallow, we have, I think we have, and I guess all parents are guilty of this and wanting our kids to fare better than we did. But that can also become a problem. I was doing some research recently where back in the 70s and 80s where we really emphasized self-esteem, what we have basically created as a narcissistic personality culture, so that we have so emphasized self-esteem that we've really set our kids up to think that they're entitled, and that without that gratification, we simply can't function. And the stories go on and on and on that I've researched to kind of validate that hypothesis.
You know, it's interesting, associated with this is a piece that was sent to me this weekend. The likely cause of addiction has been discovered, and it is not what you think. And in essence, what this individual and the author has written a book, Chasing the Scream, the First and Last Days of the War on Drugs. His name, Johann Hari, Hari. I'm going to paraphrase this. His concern or his observations are, and using research, and he used as an example of this, quite frankly, Vietnam War, and how many Vietnam vets were using drugs in Vietnam, and that when they returned to the States, many of them just gave it up. And they had the capacity to give it up because they went from a highly stressful environment, if you will, lacking the coping skills, but coped as best they could. I don't know how you cope in that environment, but okay. But they came back to the States in a more positive, pleasant atmosphere and were able to give up the drugs, for all intents and purposes, cold turkey. The point being that much of what you just described a moment ago, Ray, is that we now have created an environment where we are creating solo markets, solo communities, individuals. We don't have the camaraderie, we don't have the relationships, and that this is as much that addiction is an issue. Listen to this. That addiction, Professor Alexander argues this discovery is a profound challenge both to the right-wing view that addiction is a moral failing caused by too much hedonist partying, and the liberal view that addiction is disease taking place in the chemically hijacked brain. In fact, he argues addiction is an adaptation. It's not you, it's your surroundings for all intents and purposes. But then went on to note that you have a lot of people now that is in this environment with digital technology. We're isolating ourselves.
Yeah, that's why you can have 250 friends on Facebook and still be completely alone.
Ray Connor joining us this afternoon with Port Human Services. We may continue this for a few minutes in the second hour. If I can keep several of you here, that'll be great. If not, Ray, I appreciate it. I know you may have a commitment. We're continuing this conversation. We're talking about the issue of addiction. Hopefully we're going to get some mutes in here for youth points. We'll see if that happens. But continue this conversation for a few more minutes. I think this is an important one. And it does apply directly to our America's youth. Stay with us here on the Talk Station, FM 107, AM 1240.